Hello everyone. Today I am going to teach you about sinus arrhythmias. A cardiac arrhythmia is defined as a disturbance of the electrical rhythm of the heart. The sinus arrhythmia is defined as a cyclical alteration of the heart rate during respiration, with an increase during inspiration and a decrease during expiration. Sinus arrhythmia is a normal phenomenon and can be quite pronounced in children. Absence of this normal variation in heart rate with breathing or with changes in posture may be a feature of diabetic neuropathy, autonomic involvement in patients with diseases of peripheral nerves or increased sympathetic drive. In sinus arrhythmias, ECG shows normal P waves, PR interval, QRS complex, and each P wave is conducted to ventricles. There is a gradual decrease in RR interval and then rise again. The RR interval decreases with inspiration and increases with expiration. Sinus arrhythmia does not require treatment. Sinus bradycardia refers to the heart rate of less than 6 beats per minute. It is called sinus because each P wave is followed by a QRS complex. The causes of sinus bradycardia are myocardial infarction, sinus node disease, hypothermia, hypothyroidism, cholestatic jaundice. Raised intracranial pressure, drugs, like beta blockers, digoxin, verapamil. If sinus bradycardia is asymptomatic, then no treatment is required. Symptomatic sinus bradycardia may occur acutely during an MI and can be treated with intravenous atropine. Patients with recurrent or persistent symptomatic sinus bradycardia should be considered for pacemaker implantation. Sinus tachycardia refers to the heart rate of greater than 100 beats per minute. Its causes are anxiety, fever, anemia, heart failure, thyrotoxicosis, pheochromocytoma, and drugs, beta agonists. Sinus tachycardia is usually due to an increase in sympathetic activity associated with exercise, emotion, and pregnancy. Treatment: treat the underlying cause. For more videos like these, follow us on YouTube.